mental health problems are more common than heart disease and cancer combined. So medicine is failing to train its graduates to care for the most common health condition they face in practice. Has medicine lost its mind?
The more you talk about it, the more like the title of the book makes perfect sense.
Hey there, Vibers. Welcome to the Vibe with Kai podcast, where we keep it real, we keep it relatable, and we keep it a little bit funny as we dive into all things mental health, ADHD, and introversion. My name is Kai. I'm your host, and each week we're going to tackle life struggles with honesty, humor, and a whole lot of heart. So whether you're here for practical advice or a little validation or just a laugh about what life is like as an adult in today's world, listen, you are in the right place. We are not about toxic positivity here. We are all about being genuine to each other and to ourselves. And we're talking about real things. And we want to encourage each other and remind you that you are not alone. With that said, my friends, sit back, relax, and let's vibe through this together and enjoy today's episode of the Vibe with Kai podcast.
What up, Vibers? It's your boy, Kai. Welcome to another episode of the Vibe with Kai podcast. In today's episode, we're talking about something that affects way more people than you might think, and that is mental health care. There is a crisis here in the United States, all over the world, but we're talking specifically in the United States right now. Millions of people are struggling with mental health issues, yet most of them never get the right treatment. Why? Because, well, that's the very doctors that they turn to first, the primary care physicians, they aren't trained to handle this type of thing. And that's a huge problem. And today we're diving deep into that issue. Joining me is someone who knows this issue inside and out, Dr. Robert C. Smith. He's a university distinguished professor at Michigan State University and a award-winning expert in patient-centered care and primary care mental health. He literally wrote the book on how doctors should communicate with their patients, and his work is used in medical schools all over the country. And now he's written a new book, Has Medicine Lost Its Mind? I love that title. A bold new book that calls out the failures in our system and offers a plan to fix them. We're breaking down why mental health treatment is so broken, what needs to change, and how you, yes, you, the people listening right now, can push for better care. Let's get into it. My friend, Dr. Robert Smith, how are you?
Oh, I'm great. Thanks for having me, Kai.
Of course. Thank you so much for being here. I'm really excited to have you because, I mean, you are just a wealth of knowledge that I know that a lot of people are going to get a lot of information out of. So I want to start from the beginning. I want to talk about your personal journey here. What motivated you to write this book? Has Medicine Lost Its Mind? What motivated you to write that and take on such a massive issue in mental health care?
Yeah, well, yet, believe me, I'm a slow learner. I've been in this since about 1978.
Yeah.
And what motivated me to write this was that medicine simply is not going to change their approach to mental health care.
Mm-hmm.
And everybody knows there is a crisis, and especially since COVID, when some of the rates almost tripled.
Yes.
The problem is people like me, and there are many others, have worked very hard to develop methods, teaching methods, and practice methods for primary care doctors to provide mental health care. But medicine doesn't do anything about it. And this is why I am so-called, quote, going public. Medicine is not going to change on its own, I'm afraid.
Mm-hmm. Right.
And much as I think they might like to, but for reasons we can talk about, they're basically brainwashed into what they're doing. And
Sure.
the public is going to have to get involved and insist that medicine change. And there are ways that we can do this. But
Right.
basically right now, many people don't realize there is a crisis. They kind of assume their mental health care is just as good as their medical care. It isn't.
Mm-hmm.
And people need to understand that. They also don't know why this crisis is occurring.
Mm-hmm.
Simply put, you alluded to it. Primary care doctors provide 75 to 80% of all mental health care, but they're not trained. And so the result is predictable. They overlook most diagnoses, and the ones they make and treatment they provide usually is substandard. And the downside of this is not only these vast numbers of overdoses from benzodiazepines and from opioids, or overlooked people with suicides, but the even greater numbers. I mean, there's something like 90 million people with a mental disorder right now in this country.
Wow.
Most of those are being completely overlooked. And the downside of that then is divorce, school failure, job failure, addiction, homelessness, incarceration. Now, all of that can't be prevented, but the vast majority of it could be if doctors knew to diagnose the underlying depression, anxiety problem.
Right.
But they don't, nor do they treat it. And so much of that could be obviated, but it's not now being done. And don't blame your doctor. They're not trained. In fact,
Right. Right.
if you talk to them, as I do all the time, they'll tell you, Bob, one of them told me just the other day, there's no psychiatrist in my town. What am I supposed to do?
Wow.
Another one says, there's 2 or 3 of them, but it takes 9 or 10 months to get somebody in to see them.
Sure.
And so what I'm getting at with this example is that psychiatry sees no more than 10 to 12% of all mental health patients. Psychology probably sees an equal amount. That's why 75% of all mental health patients are seen only in primary care by doctors like me, who basically have never been trained in it. And the solution is simple. Train the doctors who provide the care. But medicine doesn't do it. And the title of the book, rhetorically, has medicine lost its blooming mind?
Right. Yeah. I'm curious, was there ever a pivotal moment in your career that made you realize the depth of the mental health crisis?
When I was in practice, and I practiced for nearly 10 years, I was just floored with the number of mental health and other psychological and social problems that came in. I trained in a tertiary medical center where all we saw was physical disease problems, but here I couldn't handle them. There was one patient in particular. This is in Has Medicine Lost Its Mind? That came in. She had advanced breast cancer, and there was basically at that time no treatment left. And I didn't know what to do with her. She would come in, she would cry, or she would say, "What am I supposed to do? I'm crying all the time. What are we going to do?" And so on. And I was frozen. I never experienced that. So I just ordered a test or something. I knew it didn't do any good for her, but it bought time. And eventually she died, and I was relieved. Only to have her husband come in about 2 weeks after she died. And he said, "I think you might like to look at this. It's her diary." And he beat out of there as quick as he could. And I wondered why he left so fast. And then I looked at the book and I realized it was just replete with comments like, "The young doctor doesn't know what to do with me. The young doctor doesn't seem to care. All he does is order tests." And there were just multiple comments like that. And that really shook me up. And I must say, it wasn't a rapid transition. It took another 6 or 7 years. But that was my introduction to just how badly trained I, and by extension, all mental primary care doctors are in mental health care. And I tried to learn it on my own then. And I got a little better at it. I learned to listen more than anything. But I still didn't know the medications, the diagnoses, and so on. And I came to appreciate with this how difficult it is to learn mental health care once you're in practice, because there's so many other things you have to do. And so I left practice then and went back to the University of Rochester and took training. And then I've been at Michigan State since, I think, 85, and been working on this very problem, first establishing doctor-patient, how to teach doctor-patient communication, and then how to teach primary care of mental health. And we did randomized controlled trials that established good, solid methods.
Mm-hmm.
But and as I've said earlier, many others have pushed medicine to do something about this. And it isn't just a few people like me. It's illustrious bodies like the Institute of Medicine. Later, the National Academy of Medicine made the same comments. Primary care was even identified in the early 2000s as the, quote, de facto mental health care system in the U.S. And yet, medicine does absolutely nothing about it. Now, they do some things, of course. You read about it. They're tinkering at the margins. They're not training the people who provide the care. And just to underscore this, of the thousands of hours, there's something like 15,000 hours of training through medical school and then through various residencies that go into primary care. Only 2% of that is devoted to mental health care. That's about a 5-week rotation in the third year in medical school. It's the only supervised training future doctors have ever received in mental health care. Contrast that with the literally thousands of hours of supervised care they get with cancer, heart attacks, strokes, obstetrics, surgery. That's supervised by people that know what they're doing in mental health, in physical health care. But that doesn't happen in mental health care.
Right.
And it's only 2%. And further underscoring how bad and what a crisis this is, mental health problems are more common than heart disease and cancer combined. So medicine is failing to train its graduates to care for the most common health condition they face in practice. Has medicine lost its mind?
The more you talk about it, the more like the title of the book makes perfect sense.
Yeah.
Perfect sense, because I get it. So what can these, because you talk a lot about training and the medical schools, and even that they recognize that this is an issue. So what can they do? Like who needs to hear this right now to actually make this change? What needs to happen now?
I mean, what needs to happen, in my opinion, and we have this long period since the 1970s, where people have been warning medicine that they need to do something about this. Medicine is refractory, and I think we need to accept that. They're just not going to change. And we can talk about why if you want. But for right now, what needs to happen is that the public needs to get involved and simply insist that medicine change. Now, that might sound like a pie in the sky until you remember Ralph Nader's "Unsafe at Any Speed" blew the whistle on the automobile industry because they were placing gear shifts where people go forward when they thought they were going backwards. They did not put seatbelts in cars because they thought people wouldn't use them and they were too expensive. Nader's book came out and induced change, and the public became so inflamed that they got change in the federal government. There's something like the Auto Motor Safety Something Act. I've forgotten the exact details of it. But that is why you have much safer cars, including why you have seatbelts in your car today. Rachel Carson with Silent Spring did a similar thing. The chemistry industry was polluting the land like crazy. There was DDT in the water we were drinking. They knew it, but they didn't do anything about it because it cost too much. So Rachel Carson's book comes out. The public gets inflamed. They insist on change. And that's why we today have the Environmental Protection Agency. And that's why we have clean water and other environmental protections. So it can be done with an inflamed public. And that's what Has Medicine Lost Its Mind plans to do. Inflame the public, and then the politicians will respond to that and change. The mechanism for that will be in my opinion, is to set up a presidential committee, excuse me, a congressional committee from the National Academy of Medicine. And what they will do is investigate medical education. And medical education is the centerpiece of the problem. And then today, medicine doesn't even touch that. They tinker at the margin. So medical education would be investigated to see how scientific it is functioning. Now, it's obvious that they will find they're not doing enough training in mental health, that maybe that's scientific. Maybe medicine thinks it's still education is scientific. It's not. Every science other than medicine has adopted what's called a systems perspective, which simply put means they consider all parts of the problem and how they interact and go together. It's pretty obvious.
Right.
Medicine doesn't do that. Medicine is the only science that does not follow a systems perspective. Specifically, it looks simply at physical body and excludes the person that has this physical disease as well as their social and environmental aspects. So medicine is not only derelict in ignoring mental health care, it is derelict in being non-scientific to a major extent.
Right. Right. One of the things that's just so beautifully said. And like, it's funny because the way you speak about it, you're like, yeah, that makes sense. We just need to do that. But then to actually have that actually happen, it's just like, it seems impossible at times, but I do hold off hope. I really do that this type of thing, because there's a lot of people I feel being made aware of this. I, for one, for example, was not even in the realm of mental health, this time 5 years ago. But then, I remember one day, this was back in 2021, I was sitting in my room and I was just like not present. I didn't know what was going on. I was scared. I didn't want to be here anymore.
Yeah.
And I was really scared. And that's when I started, truly going to therapy, on a weekly basis. I was diagnosed with a bunch of different things: anxiety, depression, ADHD, OCD. They're like, check. Okay, cool.
Yeah.
Right.
Yeah.
And it was at that point that I started to educate myself. And then that's when I decided, okay, I need to use my platform to start talking to people about this. And there's other people that I'm creative friends with that use their platforms for the same thing. And I do hold off hope, because people are having these conversations now more so than ever. And that makes me happy. And I wanted to get your thought on something. One of the things that I do on my platform, and just when I'm having conversations about mental health in general, is I try to equate it to physical health so people can understand it a little bit better, because like, you can't see my anxiety, and like I'm high functioning, right? So like, mask city over here, right? You would never know. But I try to equate it to physical health so that people can understand mental health a little bit better. What are your thoughts on people finding the commonalities between physical and mental health to help them understand it better?
Yeah, I mean, I was alluding to it earlier, is physical health is what medicine is interested in.
Right.
And it always has been. And this is where it's brainwashed. All its medical education is based in physical health. And mental health is part of the human condition, the people medicine is supposed to be taking care of. But somehow they don't train doctors to do that. Doctors are not aware. They're aware, that I shouldn't say that, but doctors do not know how to diagnose and treat mental health problems. And it's not because they're stupid. They're very bright people, and they actually try very hard. But my own experience was, I spent 6 or 7 years and I couldn't learn it on my own. Mental health education is just as difficult as physical health education. And so we need to do the same thing with mental disorders as we do with physical disorders. Medicine doesn't do that. As I said, medicine, I would spend in training, and people do today, I supervise training on, doctors will spend a month just on learning allergy. They'll spend a month on kidney disease. They'll spend a month seeing all kinds of, and it goes on for thousands of hours. This is 4 years of medical school and 3 to 5, 6 years of residency. That's a lot of time. And all they hear during that time is physical disease. And I'd have to be honest and say, there is an anti-psychiatry attitude that also comes up during that time. Why are you interested in that touchy-feely stuff? A professor might say. Others would say, well, I went to medical school to learn to treat real disease, not that fluffy stuff.
Right.
That's the kind of thing somebody talked to your grandma about. Not, I'm a doctor, I don't do those kinds of things. And it's what's called the culture of medicine. The medicine has developed this pernicious culture that exhibits and teaches an antipathy to the psychological and social aspects of medicine, emotional aspects. And central as these are to human existence, modern, and I'd put that in quotes, medicine excludes them. If you can imagine, has medicine lost its mind again?
Yeah. And so it sounds like what you're saying is that not only is there a stigma within the patient community, but there's a major stigma within the doctor community that bleeds directly into it.
Oh, yes. I had a patient once, this was in practice. She had attempted suicide, and she came to me after that. And I asked her why she changed doctors. Her doctor had berated her for attempting suicide. I mean, it is that flagrant at times. Doctors are, and again, it's not their fault. This is what they are taught to do. The entire system is stacked against it. Look at NIH funding. Less than 10% of NIH funding goes to the divisions and the institutes that apply to mental health care. I mean, and it's just replete all the way along the line. But medical education is where it starts, and it's where the fundamental change has to begin. Right now, medicine is doing something now. You read about it every day. They'll try to get better pay schedules for primary care doctors to see mental health patients, even though they're not trained. And they're making efforts, but they're missing the mark. They have left medical education completely off base.
Right. Do you find that there's a lot of misdiagnosis happening because of this? And if so, I mean, how many? I mean, I'd hate to guess how many people are, because of misdiagnosis, being misdiagnosed, how many people are just not getting the help that they truly need, and we're losing them because of that.
Okay, that's the downside of this. In the first place, most diagnoses are not even recognized. And so all of those people with depression, anxiety, ADHD, what have you, are simply, it never even is an option to put it on the table untreated.
Right.
When doctors, and the literature supports this, there's a lot of literature on this. When doctors do make diagnoses, they usually are incorrect. And when they provide treatment, it's usually insufficient or the wrong treatment. And again, it is not their fault. But again, you cannot learn mental health care on the fly while you're in practice. They need the thousands of hours of treatment during medical school and residency that we now provide for physical disease. And that needs to be integrated with the physical diseases.
Right. And I think it's important to note that this type of either misdiagnosed or untreated mental illness not only impacts the people like as individuals, but it also impacts the families and their
Oh, for
communities,
sure.
the
Yeah.
economy for sure. Can you talk a little bit more about that?
Oh, it is estimated. I'm just reading something. It is estimated that there is a $1 trillion loss in productivity for failure to recognize and effectively treat depression and other mental illnesses. That's people don't work. They stay home. They get fired. There's a loss of productivity in the economy that's just amazing. And medicine, we've talked so far, Kai, just about mental health, but medicine also excludes the psychological and social aspects of medicine that don't have mental health problems. And talk about cost, here is where the savings can come. Chronic diseases, chronic physical disease, what fills every hospital today, diabetes, heart attacks, strokes, cancer, obstetrics, surgery. All the chronic diseases are caused by lifestyle factors. Not all of them. About 80% of heart disease and diabetes and strokes are caused by lifestyle factors. What are they? Drinking too much, eating too much, not exercising, smoking too much, stress, and so on. These are all psychosocial factors. Doctors are not trained in psychosocial factors, and they are not trained in how to help prevent these very problems. Medicine instead waits for the disease to happen and then treats it. You could prevent 80% of heart disease, diabetes, and strokes by addressing these lifestyle factors preemptively. You can prevent 40% of all cancers, but medicine doesn't do it because it excludes psychological and social and mental and emotional material to have an isolated focus on physical disease. Prevention. It is estimated now. The budget, healthcare budget is around $5 trillion now. What would happen if you simply prevented half of all these people? You could reduce the healthcare budget by $1 to $2 trillion every year by prevention. And let me give you an example of where we're not doing that. In 1970, the obesity prevalence in the country was about 15%. It's now 50%. Obesity is well known to be associated with all sorts of complications, from cancer to heart disease to diabetes. That is a colossal failure in prevention. It's gone from 15 to 50%, and it's continuing to go up. Medicine doesn't do anything about it. They just wait for the disease to happen and treat it and make a lot of money doing it. What would happen to your hospitals if you reduced their population by 50%? What would happen to the sale of these new drugs for overweight and obesity if there was no market for them? What would happen to all the people doing joint transplants and so on if there was no market for them because people didn't need them any longer? And so what I'm getting at, medicine's isolated focus on physical disease has become very lucrative for medicine. And again, I'm not talking about individual doctors that are mercenary. They're not. Most of the doctors are quite, but the so-called medical industrial complex has gotten hold of this. Investment people now are investing in venture capitalism, in medicine. They're interested in making money, not helping people. And so medicine, with its physical disease focus, has become a very lucrative for the medical industrial complex. And that is one of the major impediments now to change. But if the public gets in gear, this can be done, just
Right.
like Rachel Carson and Ralph Nader did.
Right. One of the things, like as I was doing research on this beforehand, and also on my platform when with people just commenting on my Instagram and Facebook and YouTube and all that, I often get pushback from people. And one of the pushback things that I see in on this topic, and I'm curious your thoughts. Some people argue that mental health should remain exclusive domain of psychiatrists and psychologists, and that primary care doctors, like
Yeah,
that they should just stick with the physical side, and then psychiatrists, psychologists stick with the mental side. Why is I think I know why that's an issue. But could you explain for the
sure.
people that
Yeah,
don't that
I,
believe that why that's an issue?
your concern is right
Hmm.
on. I think
Yeah.
even if there were enough psychiatrists and psychologists and other mental health professionals, people first go to their primary care doctor with
Hmm.
any problem. People don't discern, I've got a mental health problem, so I'm going to go here, and I've got a physical problem, so I'm going to go here. They just go to the doctor. Now, that is the fundamental answer to that, because the doctor then has to refer them. Now, of course, they can self-refer themselves and so on, but it's a moot point, because psychology and psychiatry, in particular psychiatry, are decreasing in numbers as we talk. They are projected to be even further decreased by 2032. This is a serious problem. And let me be clear on this. We need more psychiatrists, and we need more psychologists, and we need more mental health professionals. But the first thing we need to do is train more medical people so they can do routine mental health care. We're not advocating that everybody be trained as a psychiatrist. What I want is for medical graduates to be as competent in mental health care, garden variety, depression, anxiety, substance abuse, as they are with diabetes, heart disease, and cancer. The same format would then apply. When their expertise runs out, or when they don't know what to do, they would refer it to a cardiologist, to an endocrinologist, or to a psychiatrist or psychologist. Now, it is known from careful studies that about 50 to 60% of all depression can be effectively treated with certain medication regimens. Primary care doctors, if trained and knew how to follow and diagnose these people, could manage that. The 30 to 40 to 50% of people who did not respond would be referred. And this is what I'm talking about. We're not trying to make psychiatrists out of everybody. We're just trying to make them as good at mental health as they are physical health.
Hmm. Yeah, yeah. Now, before we get into the solutions that you offer, I do have one more challenge that I see
Sure.
that I get, and a lot of times people will comment on my stuff saying that uh, there's a lot of things in mental health that are overprescribed, or or that we rely too much on medication rather than therapy, and especially because I talk a lot about ADHD, and a lot of,
Sure.
goodness gracious, a lot of people talk a lot about how, oh, ADHD is just a fad. Everybody has ADHD now. It's just like the cool thing to have, or whatever it may be. What do you say to those people that think that we just live in an overprescribed society now?
Yeah. One of the problems is, again, we're back to primary
Hmm.
care and other
Yeah.
medical doctors.
Hmm.
They prescribe, they don't know how to diagnose ADHD, and it's not easy to diagnose. Mental
Hmm.
health conditions are not easy to diagnose. It's a
Hmm.
lot easier to diagnose diabetes than it is
Hmm.
depression, believe me.
Hmm.
And doctors are simply not trained in this. One of the problems that's happened is because they cannot get mental health referrals, doctors get forced into treatment. And who is the last person that talked to them about a mental health medication? The drug representative that sees them. Well, they're pushing their own drugs for profit and have no educational training whatsoever. But doctors hear this. This is what happened with the opioid epidemic.
Mm-hmm.
Opioids were marketed, and drug reps were out talking about they're safe, they work, and they're not addictive. Well, how wrong was that?
Very, very wrong.
200,000 people died as a
Yeah.
result. And
Mm-hmm.
so, but doctors are hearing from drug reps the newest psychiatric drug. Oh, give them Seroquel for this. It works really well. And X, Y,
Mm-hmm.
and Z. These are untrained doctors who are now taking information from drug representatives who are even
Mm-hmm.
less trained and are motivated for drug sales only. And so
Yeah.
this is how lots of prescriptions come. To your other point, there is a big role for what we say non-medication treatment.
Mm-hmm.
Psychotherapy, for example, is highly effective with depression. It's probably as effective as drugs. Ideally, you need them both. When you have both psychotherapy and drugs for depression, it works even better.
Mm-hmm.
And we're also not advocating training primary care doctors in doing psychotherapy.
Right.
Basically, let's just say somebody with depression and anxiety. You would treat them with medications, and if that wasn't working, you would refer them for psychotherapy, or if the patient wanted, you would concurrently start medications and refer them for counseling. And so it's very clear that we not trying to make psychiatrists out of these people, but they
Mm-hmm.
can handle the so-called low-hanging fruit of mental health care problems. This can be managed, but it requires training,
Mm-hmm.
and it will
Yeah.
save tons of money.
Right. Right. I wanna start to give the people hope here, because we talked a lot about the
Yeah,
issues that we run into, and but there is hope, and I want to talk about some of the solutions that you put out there. One of the things you talk about, you propose a new Flexner report for mental health reform in
yeah.
medicine. Can you explain what that is and what it
Sure,
would look like in practice?
sure. The Flexner report occurred in 1910, and it basically constituted an investigation. It had been going on for 5 or 6 years by the time of the report. It was an investigation of medical schools to see how scientific they were performing at that time in the early 1900s and late 1800s. And at that time, physical disease focus that we're now talking about today was not mainly on the radar screen. Rather, doctors were doing things like bloodletting that you've heard of, applying leeches to the skin to bleed
Mm-hmm.
people out, and a host of other terrible non-scientific things. Medicine had become newly scientific at that point with its focus on physical diseases. And the Flexner report, the investigation that led to it, found that the vast majority of medical schools were not focusing on physical diseases. Instead, they were focusing on bloodletting, and there was a theory of disease called the four humors that had gone on since the 5th century BC in the time of Hippocrates. And that was totally non-scientific. And so at that point, the Flexner report, they closed the vast majority, I think 60% of medical schools. And medical schools, were training only for a year. There was no supervised training. It was just a bunch of lectures, and then doctors would go out and start bleeding people. Uh,
Yeah.
and So they shut down these medical schools and required that those who remained start adopting a physical disease-focused curriculum
Mm-hmm.
that lasted not 1 year, but 2 and eventually 4 years, and where learners were supervised in their care of various physical diseases. And that has persisted up until today. and it
Mm-hmm.
worked famously. Let us not emphasize how bad some of medicine is, but let me say something good. It worked famously, this focus on physical diseases. From 1900 to the end of the century, life survival doubled from 40 to 80. This is where you heard of all of the antibiotics, penicillin, sulfa, cured tons of diseases. They controlled others. Polio vaccines came in, smallpox vaccines, diphtheria. All this stuff was eradicated. And the results we see today, we accept it as routine. 100 years ago, this was not happening. So medicine has been highly effective. No
Mm-hmm.
question about it. No
Right.
question.
Right.
It's just that medicine has not conceptually advanced. It's just like physics originally was Newtonian physics, but along come Einstein and Planck
Mm-hmm.
and quantum
Mm-hmm.
theory and relativity
Right.
theory. Physics adapted as a science. It added to Newtonian physics. Medicine has not evolved. Medicine has cured and controlled many of the diseases where the isolated physical disease approach worked. It no longer is working for the common population
Mm-hmm.
today, which is mental health and chronic physical diseases, which are caused by psychological factors. But medicine has not adapted. Medicine is still doing what worked 100 years ago.
Right.
It needs to change. And conceptually, this is a terrible failure that it has not matured intellectually. It is hung up, as it were, in this physical disease approach.
Mm-hmm. Yeah. What can people do now? Like, particularly primary care physician. Like, for example, my girlfriend is a primary care physician down in Atlanta, right? And she, I know she's going to be listening to this right now, being like, okay, what can I do as a primary care physician right now, today, to improve their ability to diagnose and treat mental health conditions?
Yeah, there are things to do. There's one
Mm-hmm.
in Dr. McCarran in San Diego. They are actually training physicians
Mm-hmm.
in
Mm-hmm.
mental health care. So that becomes an option. There are ways you can go to conferences and learn about certain diseases.
Right.
We're
Right.
presenting at one here at the American College of Physicians on how to
Mm-hmm.
treat depression. And you can learn some extent about it there.
Mm-hmm.
But it is a long haul, any more than you could take somebody that had never heard about diabetes and heart disease and all of a sudden tell them to go to a conference over the weekend and learn about it. It would help some, but not much. And
Mm-hmm.
that's the problem. Is I'll be Johnny one note here, but this comes back to the medical schools.
Yeah.
This is where
Mm-hmm.
this brainwashing persists of the isolated focus on physical disease, and it has got to change, and it starts in the medical schools.
Yeah. Yeah. And earlier today you were talking about how the public needs to get involved as well in order
Yeah.
for this to truly
Yeah.
to take action. So with that said, how can patients advocate for better mental health when they're visiting their
Yeah.
primary care doctor?
What I would say is, as a patient, first think about exactly what you want to talk about before you get there. Doctors can be intimidating and they're often in a hurry and so on. So
Right.
think about what you want to talk about and order it. What's most important, what's second and third. Practice it a little bit. And then when you get into the doctor who's rushing in, just say, no, wait a minute, I've got some things I want to talk about and we need to get resolved today. Doctors actually appreciate that. They focuses them. They can then address what you want to do.
Right.
If you think you have a mental health problem, you feel depressed, you feel anxious, you're taking too many medications or marijuana or whatever, be upfront and say, I am worried about this, I would like to see a psychologist or a psychiatrist. Be explicit, and make requests. And the main thing is do not be intimidated. Doctors actually appreciate this if you're upfront and say what you want, but don't hesitate to interrupt them if this is not happening.
Right. You've dedicated much of your career to fixing a very, very broken system. What keeps you optimistic about the change? Like, do you feel like this is like everything that you're talking about? Is it possible? Do you feel hopeful and optimistic about this?
Yeah. To me, the most encouraging thing is the public knows there's a problem, and an inflamed, informed public will get something done.
Yes.
Medicine is off the tracks, as it were. Medicine needs help, and the public needs to do it. And it can be done. In fact, you've got my website, but it's robertcsmithmd.com. And don't forget the MD, because there are too many Smiths otherwise. It's robertcsmithmd.com. On the very first page, when you go there, there is a sample letter. You can send that to, and there are addresses, email addresses, the President, the Surgeon General, the National Academy of Medicine, your congressperson, and your senator. All you've got to do is click on that and then follow your nose through that and send this letter requesting a systematic investigation of medical school education. Once that happens, the problem will get resolved. And it is critical that you do that. You can also add, Kai, you've been talking yourself about some of the issues you've had, as have many people. A fourth of all people in the country right now have a mental health disorder. And so if you've had issues with difficulty receiving effective mental health care, put your own paragraph in there, and then you can plug the paragraph I've got on my website. But this is the way to get the politicians going.
Absolutely. I love this. The book, it's called Has Medicine Lost Its Mind? Is it out already, or does it come out in March?
March 4th.
March 4th. It's coming up. It's coming up soon. So I'm going to include a link to that book where people, all you have to do is look in the description of this podcast. All you have to do is click, pre-order your copy. Make sure you get it. I'm certainly going to be getting it and reading it through, because this is really, really important stuff. And everybody that listens to me and watches me, y'all know, I was so happy when your name came across my inbox, because I'm like, oh, this is my jam. This is the kind of stuff I want to be talking about. So I cannot say thank you enough, and how much I appreciate you and your insight. And if you don't mind, just to kind of wrap it up, any parting words that you want to give to anybody watching about your plan, your goal, your hope, whatever it may be, some parting words for everybody listening and watching.
Just be hopeful. We can change medicine, just like the automobile industry was changed, and just like the chemical industry was changed. We can change medicine. So write in, get that website, robertcsmithmd.com, send a letter to your representatives, and it insists that they do something about this.
Yes,
we
absolutely.
can be effective together.
Absolutely. And I will be right there. I'll be right there sending letters on my end, because I think this is really, really important. So, Dr. Smith, thank you so much. Again, everybody that's listening, watching right now, you want to learn more, all of the information is going to be clickable in the description of this podcast.
And that's a wrap on this week's episode of the Vibe with Kai podcast. Thank you so much for tuning in. Thank you so much for watching. Thank you so much for listening. I hope that you found a little bit of comfort in today's episode, and I hope that you're walking away with a little bit of encouragement, and I hope that you laughed a little bit along the way. If you enjoyed this episode, please be sure to like and subscribe and leave a review. Let me know what you thought of the episode. I really want to hear your voice. I want to hear your story. I want to hear all about your journey Let's keep the conversation going. Make sure you follow me on all of your favorite social media platforms. Follow me on TikTok, Facebook, Instagram, whatever it may be, at The Vibe with Kai for more tips, more laughs, and more real talk. Remember, my friends, you are not alone on this journey. We are in this together. And until next time, stay kind to yourself, embrace the journey, and keep vibing. I'll catch you next time. Much love. Good vibes.